Hello, everybody. This is Chapter 6, Health and Wellness. And it's a lot of information, so buckle up, buttercups. All right. So, what is healthcare? It's a complicated system that involves local, state, national, and international health issues. And what's going on in the world globally affects us, right? So, it affects local health concerns because of all different kinds of changes. Look at the pandemic, right? And as nurses, we have to be aware not just of things affecting us locally, but globally. And we need to be able to answer questions and guide our clients and also to try to help them find solutions. These are part of our job description and our duties, okay? The WHO, which is the World Health Organization, was established in 1948 by the UN, and its goals were to try to improve worldwide health, okay? Um, Recently, just FYI, we have been disassociated with the World Health Organization by Mr. Trump. And so we'll have to see where that brings us because that's not good news. But at any rate, we'll leave politics out of this lecture. What is the definition of health? It's a state of physical, mental, and social well-being. It's not just absence of disease. It means that everything about you, your physical, mental, and social states are all in homeostasis, right? It's balanced. And our health influences everything in our lives. What's the price tag on your good health? There isn't one. So workplace, social, professional, interpersonal relationships, all of these things are influenced by our general state of health. Okay. And we as nurses have to look at the health issues in broad, holistic ways. In other words, physical health, emotional health, mental health, social health, and spiritual health are all important. Okay. What is disease? Disease is a change in structure or function of our body or our biologic systems or our mind, because it can be mental. And illness is the response to disease, okay, that involves the change in function. Well, what causes disease? Can be infection, which is a change in the structure or function because of an invasion of microorganisms or pathogens. And remember something, people will respond to a threat to their well-being or wellness, whether it's actual or just perceived. So in other words, think about stress and what stress does to your state of mind. And your state of mind affects your health state. So you have to remember all these things, one always affects the other. There are lots of disparities. The word disparity means a gap, right, between some people's health benefits and other people's. And those disparities are there because of social issues, economic issues, where people live, rural versus urban. There are lots of gaps. Some people don't get the help that they need. I know this. I mean, I was on Medicaid, so I know the difference between Medicaid and having Blue Cross and Blue Shield, PPO. Not the same kind of care. So the more education that you have, the better your health is. It's a fact that higher levels of education are associated with a better quality of life. The more you know, the more you have power. All right, here are two terms you need to know. Morbidity, which means the number of people with a specific illness or disorder. Mortality means the chance of death associated with a particular illness or disorder. And the CDC has all these rates right on their website. You can find them if you're interested. Here I've listed the 15 leading causes of morbidity and mortality. And right up top, heart disease, malignant neoplasms, which are cancer, chronic lower respiratory disease, COPD, cerebrovascular disease, stroke, accidents or unintentional injuries, Alzheimer's, diabetes, influenza and pneumonia, kidney issues like nephritis, nephrotic syndrome, suicide, septicemia, chronic liver disease and cirrhosis, hypertension, Parkinson's, and aspiration pneumonia. How about that? Um, the big issue is money. I hate to say it, but funding is a major concern, and that's the big problem. It's money, 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 money. And we need to do something to make sure that we're using our healthcare system as effectively as we can. And I will tell you this, we are not. Following statement, true or false, is mortality the chance of death associated with an illness? If you said true, you were right. That's what mortality means, the chance of death related to illness. Now, here's some important stuff. Primary, secondary, and tertiary healthcare. Okay, this is something that you need to know. So primary health care is prevention. Think anti-smoking, mammography, prenatal care. Secondary is when you go actually to the healthcare system to get care. And tertiary is, think of that as rehab. Okay. And the board likes to ask about those things: primary, secondary, tertiary. Okay. So when we think about primary, prevention, programs for immunizations, putting your baby in a child seat, right, in the car, fitness, nutrition, health education in schools. These are all examples of primary, they're prevention. Secondary, well, we missed it. That's where now there's an illness, we identify it, diagnose it, and we try to prevent it from getting worse, right? So those kinds of things, which isn't great. And then tertiary is, after an injury or an illness, what can we do to rehab the person? And that's not just physical, that can be mental, right? So it can be referrals to support groups. It can be promoting independence after a traumatic brain injury. It can be physical rehab because of a fracture or a fall. Okay. There's a website called Healthy People 2030, and the Board of Nursing likes to ask about this. This is a government website. It's developed by the U.S. Department of Health and Human Services, and they put it together to set goals. And I got to tell you, the goals are bad. We are not meeting them. As a matter of fact, the numbers are getting worse, especially for obesity in this country and type 2 diabetes. Instead of the numbers going down like they were hoping, they've gone up. So, something ain't right. Okay. So what is the wellness and illness continuum? It's, your daily state of health falls somewhere between you're in good health or you're dead. That's really what it is. How well are you taking care of yourself? How well are you trying to prevent illness or injury? Are you using your full intellectual potential? Are you managing your stress? Stress will kill you. Do you have good interpersonal relationships? Do you have friends, family, those kinds of things? And are you empathetic and concerned about your environment and the human condition? Believe it or not, having those qualities improves your state of health. It's a fact. All right. I'll get off my soapbox. I won't preach. What's the difference between acute illness and chronic illness? So acute illness comes on suddenly, and it's something that is usually for a short period of time. And, you either get better or you die. Chronic illness is something that's long-term. Think of COPD, right? You're going to have it for a long time, and it can turn into an acute exacerbation. Think about heart failure, those kinds of things. So it's very common for somebody with a chronic illness to have acute exacerbations of the illness. Okay. Arthritis. You think that's an acute illness? False. Arthritis is chronic. Okay. It's something that is progressive and degenerative, and it comes from wear and tear on the joints. And at some point, it's going to get worse, unfortunately, and it's long term. All right. Maslow. We talked about Maslow before, and it's important to remember him because the board likes Mr. Maslow. Maslow's hierarchy. Okay. And the responsibilities of us as nurses as it relates to that health illness continuum. If a client is in survival mode because they don't have a roof over their head or they don't know where their next meal is coming from, then how can we possibly try to help them with their emotional state? So we have to fulfill basic needs, right? And we don't work alone, right? We have social workers that we can, go to for help if we have clients that are in these kinds of situations. But we need to address the whole person, the whole human. Okay. Lifestyle. This is one of the biggest problems in this country. The reason that those numbers on Healthy People 2030 are so bad. Risk factors. Some risk factors are modifiable, others are not. Things like your age, your gender, and your genetics, you can't change. Now, let me just throw something in here. I understand the transgender population. However, inside, they're still what they were when they were born genetically. You cannot change what sperm fertilized your mom's egg and made you. That can't be changed. So even you can remove your penis, you can, grow one, I guess, or whatever. You can get boobs or get rid of them. It doesn't matter on the inside, right? Your genetics are non-modifiable also. So if your family has a really strong history of cancer or heart disease or hypertension, that exponentially increases your risk. Okay. You can't change your genetics, but there are things you can do to fight those odds, like your level of activity, your weight, what you eat. Those things are modifiable. They're things that you can change, right? Smoking, for everybody else, but not for me, smoking is bad, just to be clear. My cigarettes have vitamins in them, but overall, cigarettes are bad for you, just so you know. And so is secondhand smoke. All right. So those things are bad for other people. And everybody needs physical activity. You need to actually raise your heart rate and sweat. You have to. And then, of course, there's the issue in this country of substance abuse, substance use disorder, which has gotten way out of hand. All right. So here I've listed the risk factors, right, and explained them. So your genetics, heredity makes you predisposed to certain things, especially heart disease, cancer, and mental illness. Your gender also is a risk factor for certain diseases. Women have a higher rate of autoimmune disorders. Men have a higher suicide rate. Physiologic factors, in other words, things like being obese, right? Body mass index above 25, anything over 30, you're morbidly obese. 25 to 30, you probably could stand to lose a little weight, right? Environmental factors, where do you work and where do you live, right? Do you work around toxic chemicals? How's the water quality where you live? Is there air pollution? Right? These things can cause long-term damaging effects. What kind of lifestyle do you lead? And these are questions we have to ask clients. You know, are you monogamous? Right? Or do you have multiple sexual partners? Because that will put you at risk for sexually transmitted diseases. Do you like to tan? Like I said, that's bad for most people, not me, but other people. Do you exercise? Are you eating a balanced diet? Are you managing your stress? These are risk behaviors associated to lifestyle choices. You can change those choices. Age, can't change that. I wish you could, because I would turn mine back, but you cannot change your age. And there are certain things that age does predispose you to. You know, if you were sexually active before the age of 20, you need to start early screenings with OBGYN, you know, and pap tests and those kinds of things. Let's talk about testing. These things are super important. So I would make sure that you make note of these. Everybody should have a general physical, right? Every 1 to 3 years for women and every 5 years for men. But after 40, probably every year. Okay. That's just a routine, general, go see the doctor, get a general physical. Okay. Your teeth, you should have a dental assessment every 6 months. Okay. Every 6 months. Doesn't matter what age you are. Tuberculosis, TB tests. Generally, we do them for healthcare workers and then for people that are immunocompromised. But it depends on other things too. So that, you know, we say at least yearly to be screened. Okay. Blood pressure. How often should your blood pressure be evaluated? At least every 2 years, but if it's ever been elevated, at least once a year. Okay. Your body mass index, they should get your height, your weight, and do that calculation with every physical. Your cholesterol and your sugar. Cholesterol, beginning at age 20, should be checked a minimum every 5 years. And your blood sugar, starting at age 45, every 3 years. And those numbers would only change if there's a problem. Okay, if there's a problem. I'm going to highlight this whole page. Okay. More tests. Your vision. Okay. Under 40, 3 to 5 years is sufficient. Once you get 40 to 65 every 2 years, and after 65 every year. How many people are driving and probably shouldn't be? Okay, so that's important. Your hearing. There's no guideline for hearing acuity checks unless people are saying, you keep saying, huh? What? Excuse me? What'd you say? What? I can't hear you. Then maybe there's a problem and you should get your hearing checked. I'll tell you this, with older folks, there is a problem with a greater production of cerumen. So if they get wax buildup, then they may have difficulty hearing, and it could be very simple. Just get the wax out. Skin, every 3 years. ages 20 to 40, and then every year after 40, you're looking for anything. Some people have freckles, moles, those kinds of things. You're looking for any mole or freckle or skin lesion that changes size or shape or has ridges or irregular borders. Those are all worrisome signs of potential skin cancer. How often should the doctor put his or her finger up your butt? Well, during routine examination, okay? Um, After 76, we pretty much stop it because we figure we don't need to do it anymore. So ATI says at 76, we can stop it. I don't know where they arbitrarily chose the number 76. I'm not highlighting that, but that is from the book. So just FYI. Colorectal screening. The rates of colorectal cancer in this country are high. For people between the ages of 50 and 75, every 5 years for flexible sigmoidoscopy or a colonoscopy every 10 years, unless you are high risk. What's high risk? So high risk means you have an immediate family member that has a history or currently has or died from either colorectal cancer or another form of cancer. That would make you high risk. Or if you suddenly notice a change in bowel movements. In other words, you were regular and now all of a sudden you've got diarrhea all the time. Any change in bowel movements is something that your body's telling you, go get checked, right? So make sure you know that. Now, for women, Pap test. And a Pap test is where they scrape your cervix and they're looking for cervical cancer. So nobody in this country should die from cervical cancer. Every 3 years from 20 to 29. Then ages 30 to 65 every 5 years, unless you've had a positive. And then mammogram, right? Mammograms, when you're 40 or over, you should have them annually, although now insurances are paying only for every 3 years, even after 40, unless you have a family history, which would make you high risk. And breast self-examination is recommended to be done monthly, and it should be done the week after your period. And I'm actually going to put that in this PowerPoint right here. So breast, oops, I can spell, breast self-examination, that should be done monthly and always the week after your period. And the reason is some people get cystic breasts when they have their periods. So, finding a lump or a bump there might not be a good indicator. You might be running back and forth to the doctor all the time. So you should do it in the shower, and we will go over breast self-examination and how it's done. So to make sure that you know how to do it and understand something. If you do find a lump, cancer initially does not hurt. No pain. So people will say, oh, I found a lump and it hurts. And I'd say, well, that's good. That's probably nothing, probably a cyst. But if you find a lump and it's not tender and it doesn't hurt at all, and it's the week after, a week to 10 days after your period, go get it checked. Just go get it checked. Okay. Okay. For men, they should have their testicles examined routinely every visit to the doctor starting at age 20. That's where, the doctor holds their testicles and says, turn your head and cough. And also feeling for any lumps or bumps or anything, they should feel smooth like two marbles in the scrotum. PSA, prostate specific antigen, and digital rectal exam. Again, doctors like to stick fingers up the butt. They do. No, they don't. They probably hate it. That should be done for men every year, beginning at age 50. Okay, because prostate cancer and also BPH, benign prostatic hyperplasia or hypertrophy. If we find it early, we can treat it. And even cancer, if cancer is diagnosed early, the earlier it's found, the more treatable it is. The problem with cancer is they find it late and it's already metastasized. Okay, so we talked about stress. Let's just talk about it one more time. Stress is normal. You're not going to get rid of it. You can't eliminate stress. You cannot. You have to learn how to manage it. Okay. And you can be stressed out from bad things and good things. And this is important to know. Changes in jobs, starting a new job, divorce, marriage. These are all stressors. Okay. And if they keep building up and building up, eventually you're going to be ill. Okay. They will cause physiological responses. We have defense mechanisms like denial, projection, repression, and regression. There are things that we do to defend our mind from stress. Some of them are healthy and some of them are not. So, and we'll talk about them. Here's a page that goes over defense mechanisms and how they work and examples of them. Okay. Sorry about that little break. All right. Defense mechanisms. All of them here you need to know. Rationalization, displacement, regression, introjection, reaction formation, repression, and sublimation. Okay. Rationalization, you're going to use an excuse, right? I didn't do well on the test because the teacher doesn't like me. Or I didn't do well on the test because the questions were just too tricky. Displacement is transferring how you feel to somebody else. So if you're angry with your boss, you go home and kick the dog, right? Regression, you go to a previous level of behavior. You usually see this with kids that are ill. If they were potty trained, suddenly they're wetting the bed, okay? Introjection. So you try to take on the qualities or attitudes of someone else. Sometimes that's a form of flattery. Sometimes it's a form of mental illness. So, within reason. In other words, maybe you admire an actor and he got on and talked about his politics and now you want to believe what he believes. Okay. It's like emulation, emulating somebody. Reaction formation is behaving the opposite of how you feel. The opposite of how you feel. So you have a kid that was an accident, but then you feel guilty inside because you knew the kid was an accident. So to overcompensate, you overprotective of that kid, right? So acting the opposite of how you feel. Repression is where you just take the thoughts and you go, you know what? They're not there. It didn't happen. It's not real. It's you were raped, and of course it's a traumatic event. So what you do is you repress that memory. And then sublimation is turning something that's unacceptable into something acceptable. I like to mess around with dead bodies and touch them and feel them. So I become a mortician. That's the easiest explanation I can give for that one. So now I've taken something that people would go, ooh, that's weird, but I'm a mortician. It's not weird anymore, right? Okay. So those are defense mechanisms. Know them. Okay. Violence and abuse is a risk factor too, and risk factors for domestic abuse are things like low self-esteem, low income, not being educated, alcohol and drug use. I mean, this is a very long list. People that have been abused either are abusers or get abused. It's really a terrible, terrible cycle that goes on. So understand that these risk factors, you don't need to know them all, but please know at least some of the risk factors for violence and abuse and domestic abuse. Um, you know, where you live is also a risk factor for abuse. If you live in the ghetto, I know because I used to. Um, Relationship risk factors, unemployment, somebody loses their job, money, economic problems, arguments, those kinds of things. They can really make you fall out of love. And not only that, they can put you at risk for violence. Sometimes people will pop under stress. Um, Elder abuse, and this one is a big one. So when folks get older and they become dependent on other people to take care of them, we see things like, and I've seen this a lot, physical abuse, neglect, having them lie in an adult brief that's filled with urine and feces for hours. Um, you know, it's a real bad problem. And these elderly people are easy targets for different types of abuse because of the fact that, as they get older, they get weaker and become more reliant on caregivers, right? We are ethically, morally, and legally, okay, illegally required to report any suspicion of any type of abuse. Period. End of story. It's not negotiable. Okay. Even if you're wrong. Okay. Sudden infant death syndrome is increased for children of mothers who smoked. The answer is yes. And that's just these PowerPoints, they throw in these random questions, but there you go. If you smoke when you're pregnant, it is very dangerous. I smoke, but I did not smoke when I was pregnant. And I got very fat, but that's okay. I had healthy babies. Smoking really does increase a lot of risks, including SIDS, sudden infant death syndrome. Also, low birth weight, preterm babies, and stillborn babies that are born dead. Education is really the key to prevention of disease, believe it or not. Understanding the healthcare system, understanding your body, and the higher educational level, the better healthcare is for people. This way you become aware of your risks, lifestyle factors. You know, you as nurses, all of us, we have to make sure that we're providing factual information to people too. There's information out there that is not real. I don't know if you know this, but there's this thing called Facebook and Instagram, these social media sites. I don't know if you've ever seen them, but they're a problem because sometimes people put wrong information, BS, on there, and people will just believe it. Make sure you're going to credible sites to find your information, okay? Not because your cousin's sister said it. Health-related concerns as they apply to age, right? Different age groups have different concerns, okay? With infants, the leading causes of death are chromosomal abnormalities and congenital issues. In other words, things that they're born with. And of course, mom's educational level and financial resources are a big factor in whether babies are healthy and survive. Yep, it's always mom's fault. For children, the leading cause of death, accidents, accidental injury, things like drowning. Okay, make sure you know that, the leading cause of death. Leading cause of disease in kids is asthma. Okay. And the biggest healthcare concern now, never was before, obesity. Obesity in children, little children. For adolescents and younger adults, they're, drinking, drugs, and car accidents are the three big killers of young adults. Okay. And a lot of that has to do with peer pressure and, who they hang out with and parental guidance and those kinds of things. Suicide and eating disorders have become, suicide's the third leading cause of death for people 15 to 25. That's crazy. That's a lot of people. And then eating disorders, it's up there. It's not in the top 5, but it's up there. Anorexia nervosa, those kinds of things. For older adults, hypertension and heart disease and diabetes, right? And then, of course, for women and men, cancers. You don't need to know these, so I'm just going over them. For old people, not me, other old people, heart disease, cancer, stroke, COPD, pneumonia, the flu kills a lot of people, more than guns. Okay. And then chronic problems like arthritis, osteoporosis, incontinence, vision and hearing loss, and then dementia, because that's a problem. Okay. We're just going to cut to the end here. Categories of disease. So with diseases, the categories are, right? A disease, what is the etiology, the body system, the extent of involvement, and how did they get it, right? So we have organic diseases and functional diseases. Organic, something organic means that I can find it in your body. It's either like a bacteria or a virus or a spore or mold or fungus. A functional disease is something I can't identify the cause, right? So that those two things, you should know the difference between organic and functional. And when we say the word etiology, that means the cause. What caused the disease? That is the etiology of a disease. Congenital disorders, don't confuse them with hereditary. A congenital disorder is genetic, present at birth, and it's inherited. You can't fight it. So if 2 people have sickle cell and they have children, the children will have sickle cell, right? Infectious diseases are things like I said, they can be local or systemic. They can be bacteria, viruses, spores, molds, fungi. And then you can have diseases related to deficiencies. In other words, because of diet, or lack of exercise. You don't have enough of a certain thing. Metabolic disorders usually have to do with the endocrine system not working right. And neoplastic disorders are cancers. Cancers. Okay, when we say neoplasm, neoplasm means new growth, but we are referring to cancer. A traumatic injury is something that is like an accident, or it can be a mental traumatic injury, like someone who witnessed a violent crime or someone who was raped. Occupational disorders also are problems. Where do you work? Are you at risk? Even nurses are at risk now. In hospitals and everywhere else, it's becoming increasingly dangerous. So I hope that didn't bore you too much. That's all I have for this one. Make sure you know all the things that I talked about that were important. Make sure you know the words etiology. Make sure you know all the coping mechanisms. And that's all I have for you right now. Have fun with this. Until next time, see ya.